Namaskar and welcome to yet another episode of Bright Talks by Pacholi Aesthetics and Wellness, an educational initiative by Dr. Preeti Seth in public interest. बच्चों की जब भी बात आती है तो हमारे पास ढेरों एडवाइजेस होती हैं, हमारे बड़े बुजुर्गों की, हमारे रिलेटिव्स की और हमारे फ्रेंड्स की, एंड उन एडवाइजेस के बीच में कहीं राइट एडवाइस गुम हो जाती है. So today, to burst all the medical related myths, we have with us a very eminent doctor, जो कि है clinical director and head neonatology Cloud9 Hospital. Not only that, he is a clinical head for Tele NICU project, and he adorns under his name more than 20 national and international publications. Yes, let's welcome Dr. Rohit Arora. Namaskar, doctor.
Namaskar. Thanks for the kind introduction.
Thank you so much for joining us today. So for all those who are joining in, we will be taking your questions after the session, and also do not forget to tap on to the heart button and shower us lots and lots of love. Remember, it is your show और आपके questions हमारे लिए बहुत important हैं. So doctor, the first question which all the viewers wanted to ask from you is ग्रोइंग पेन्स, जिनको हम कॉमनली रेफर करते हैं, क्या वो एक मिसकंसेप्शन है कि वो एसोसिएटेड है विद फिजियोलॉजिकल ग्रोथ इंडिकेटर्स या वो एक्चुअली कोई डेफिशिएंसी है?
ओके, सो ग्रोइंग पेन्स जनरली कंसिडर किए जाते हैं कि जब बच्चा बड़ा हो रहा है, उनकी बोन्स और मसल्स ग्रो कर रही है, देयरफॉर वो पेन्स आते हैं. सो इसमें कुछ सच्चाई है और कुछ नहीं है. अगर ये पेन्स एवरी फ्यू मंथ्स में 3-4 हफ्ते के लिए आते हैं और इसमें बच्चा ये शाम के समय ज़्यादा आते हैं, इसमें बच्चे को प्यास ज़्यादा लगती है, भूख कम लगती है, तो येस, दे कैन बी एसोसिएटेड विद द ग्रोथ ऑफ द चाइल्ड. बट जनरली जो पेरेंट्स अज्यूम करते हैं ग्रोइंग पेन्स, वो ये होते हैं कि बच्चे बाहर जब खेलने कूदने जाते हैं उस समय उनको रियलाइज़ नहीं होता कि बॉडी में कुछ पेन है, बट वंस दे कम बैक एंड दे लाई डाउन ऑन द बेड एंड नींद के समय, उस समय जब जो दर्द होते हैं वो जनरली problems parents लेके आते हैं, and that's the one they consider it as a growing pain, which is actually not a true growing pain. So ऐसे ये differentiate कर सकते हैं कि ये पेन अगर मसल्स में हो रहा है, काफ मसल्स, थाई मसल्स में, rather than कि जॉइंट्स में, आपके घुटनों में या एंकल में हो रहा है, तो वो ग्रोइंग पेन है. अगर वो घुटने, एंकल, हिप्स में है तो दे आर नॉट ग्रोइंग पेन. दे कैन बी सम ऑर्गेनिक प्रॉब्लम, उसमें कुछ लोकल इशू हो सकता है. सो वो आपको ध्यान रखना पड़ेगा कि वो ग्रोइंग पेन है या किसी और प्रॉब्लम से रिलेटेड तो नहीं है. तो इन चीज़ों का आपको ध्यान रखना पड़ेगा डिफरेंशिएट करने के लिए. इन कंडीशंस में जनरली आपको बच्चे का साथ देना है, खूब सारा पानी पिलाना है, हाइड्रेशन रखने से ग्रोइंग पेन्स कम हो जाते हैं, एंड स्लीप, रेस्ट, ऑल ये सब करने से भी ग्रोइंग पेन में हेल्प मिलती है. बट इफ़ दे कंटिन्यू, इफ़ दे डोंट सेटल डाउन ऑन देयर ओन, then better to consult your physician और उससे अगर कोई प्रॉब्लम है तो उसका निवार पा सकते हैं.
Thank you so much, doctor, for a wonderful information. So now you all know what is the growing pain and actually कब हमें आइडेंटिफाई करना चाहिए कि ग्रोइंग पेन्स हैं या एक एक्चुअल मेडिकल कंसर्न है, एंड वी मस्ट कंसल्ट आवर डॉक्टर. सो डॉक्टर हैज़ ऑल्सो एडवाइज यू कि अगर आप उस टाइम पे हाइड्रेटेड रखेंगे बॉडी को, बहुत सारा पानी पिलाएंगे, तो दैट इज़ गोइंग टू हेल्प. सर, नेक्स्ट क्वेश्चन इज़ वाइट पैचेस. हम जनरली बच्चों के फेसेस पे देखते हैं वाइट पैचेस और हम हमेशा उसको एसोसिएट करते हैं विद कैल्शियम डेफिशिएंसी. तो क्या रीजंस हो सकते हैं वाइट पैचेस के, और ये क्यों इतने कॉमन है चिल्ड्रन में, और क्या इसके नीचे कोई और सिवियर अंडरलाइंग कॉज हो सकता है?
हाँ, सो सी, वाइट पैचेस एज यू सेड आर कंसिडर्ड टू बी एसोसिएटेड विद कैल्शियम की कमी से, बट ऐसा एक्चुअली होता नहीं है. मोस्ट केसेस में कैल्शियम की कमी से वाइट पैचेस नहीं होते. इट्स जस्ट एन इंडिकेटर कि बच्चे में मॉइस्चर की कमी है. मोस्ट ऑफ द केसेस में दे आर ग्रोइंग फास्ट, देयर स्किन समटाइम्स लैग्स बिहाइंड देयर ग्रोथ, एंड द फैक्ट कि हम स्पेशली नॉर्थ इंडिया में जहाँ की एनवायरनमेंट में मॉइस्चर की कमी है, उस वजह से बच्चों को वाइट पैचेस होने के चांसेस रहते हैं. सही काइंड ऑफ मॉइस्चराइजर ना यूज़ करना, पानी कम पीना, ऑल दिस ऑल्सो कंट्रीब्यूट. Then another cause can be some kind of a fungal infection. बच्चों को जो बड़े होते हैं, इसको पिट्रियासिस अल्बा कहते हैं, जो कि सफ़ेद पैचेस प्रोड्यूस करता है फेस पे, नेक एरिया में, अपर बॉडी पार्ट्स में, उससे भी वाइट पैचेस होते हैं. सो इसका आपको निजात पाने के लिए खूब सारा पानी पीना है, अगेन हाइड्रेशन, यूज द राइट काइंड ऑफ मॉइस्चराइजर, इवन ऑयल एप्लीकेशन, राइट। अगर आप बच्चों को रेगुलर मसाज भी करेंगे विद गुड ऑयल, इवन दैट विल टेक केयर ऑफ दिस काइंड ऑफ सिचुएशन। ऑल्सो अगर आप नहीं ठीक हो रहा है और बच्चे को बॉडी इमेज, जैसे जैसे बच्चे बड़े होते हैं, क्योंकि ये वाइट पैचेस जनरली 3 से 12 साल की एज में आते हैं जब बच्चों की बॉडी इमेज बन रही होती है। सो उस समय अगर ऐसा बच्चे को लग रहा है, देन यू कैन यूज सर्टेन एंटी इन्फ्लेमेटरी क्रीम्स, ऑल्सो माइल्ड क्रीम्स विच योर डॉक्टर कैन प्रिस्क्राइब यू। सो मॉइस्चर, hydration, and if required, anti-inflammatory creams at times.
Wonderful. I even didn't knew that white patches can also be because of lack of moisture in the skin, because definitely there's a collagen deficiency because skin is fastly growing and you are growing in that period of time. So it's a wonderful tip by doctor that you can hydrate, apply the right moisture, and definitely it is going to help you out. So for all those who have joined us now, it is Dr. Divya Agarwal, your host for today, and we are on Bright Talks by Pacholi Aesthetics and Wellness, an educational initiative by Dr. Preeti Seth, and we have with us a wonderful eminent doctor, Dr. Rohit Arora, and we are discussing about your child's health, and we are here to debunk all the myths associated with the information that you get from your elders, from your neighbors, and from your family and friends. So, doctor, worm infestation in stomach is also a very common thing in children. And उसको कैसे identify कर सकते हैं? क्या silently भी कभी हमें कोई symptom नहीं हो and the child can be having worms inside? कैसे उसको identify करना और कैसे उससे बचना है?
हाँ जी, सो वर्म्स पेट में होना पेरेंट्स बहुत कॉमनली आते हैं, पेट में दर्द हो रहा है तो वर्म्स तो नहीं है। सो यस, हम बाहर खाना खाते हैं, हम हर जगह जाते हैं, बच्चे मिट्टी में खेलते हैं, ऑल दीज कैन लीड टू वर्म्स इन द टमी, एंड राइट फ्रॉम old age to small babies, anybody can get worms. Of course, kids are more prone. So राउंड वर्म, हुक वर्म, पिन वर्म, ये 3 तरह के वर्म्स होते हैं जो बच्चों में खास तरह से पाए जाते हैं। और ये पता कैसे चलता है कि पेट में ब्लोटिंग हो रहा है, डिस्कम्फर्ट हो रहा है, दर्द हो रहा है बच्चों को पेट में। देन स्पेशली इन द नाइट टाइम दे कैन हैव वेरी इचिंग इन द एनल एरिया। पूप के रास्ते में बहुत बहुत इंटेंस इचिंग होती है, बच्चे वहाँ से हाथ ही नहीं हटाते, एकदम इच करते हैं। दैट्स अ वेरी क्लासिकल साइन ऑफ हैविंग अ पिन वर्म इन्फेक्शन। सो इसके अलावा कई बार वॉमिटिंग हो सकता है, स्लीप डिस्टर्बेंस हो सकता है, बच्चों को भूख नहीं लगता है। ये सारे कारण होते हैं जो पॉइंट करते हैं कि शायद बच्चे को वर्म्स के इन्फेक्शन हो चुका है। सो उसके लिए एज आई सेड 3 तरह की मेडिसिन होती हैं जो कि ली जा सकती है। थैंकफुली इट्स वेरी इजी टू ट्रीट दिस काइंड ऑफ एन इन्फेक्शन। आपको जस्ट एक बार मेडिसिन लेनी है, किसी भी तरह का वर्म होगा वो उसको रिस्पॉन्ड कर जाता है। And if you document the worms in the stools by doing एक stool test करा सकते हैं, तो उसके बाद दवा देंगे तो आपको एक बार रिपीट भी देना है 2 हफ्ते के बाद, because दवा will kill the worms but it will not take care of the eggs of the worms. So जब वो eggs hatch होंगे, नए worms बनेंगे, उसमें 10 दिन से 2 हफ्ता का टाइम लगता है, and then therefore you have to repeat the medicine again after 2 weeks, otherwise वो बार बार होते रहते हैं। Also, to add to that, it's a good idea कि पूरे परिवार को ट्रीट किया जाए, क्योंकि अगर घर में एक को है तो हो सकता है और मेंबर्स को भी हो। So might as well give treatment to सब लोगों को, घर में जितने बच्चे बड़े हैं सबको एक बार एटलीस्ट मेडिसिन ले लेनी चाहिए।
So that means अगर वर्म का आपको डाउट होता है या डॉक्टर आपको एडवाइस करते हैं तो you have to not only treat your child, you have to treat yourself as well, because there is a likelihood that you are also infected with the worm. So that's a wonderful advice by Dr. Rohit. And the next question is, Doctor, आजकल हमने सुना है कि इन्फेंट्स में हम शुगर एंड सॉल्ट अवॉइड करने को बोलते हैं। ऐसा क्यों है? बिकॉज हम तो जब छोटे थे तो हमने शायद शुगर एंड सॉल्ट अवॉइड नहीं किया था 1 साल से पहले, तो ऐसा क्यों है? ये अब चीज़ें आई हैं सुनने को, या पहले भी था या हम इग्नोर करते थे? सो व्हाट इज द एक्चुअल कॉन्सेप्ट बिहाइंड इट?
हाँ, सी certain things are very ingrained in our culture. Yeah. So it's difficult to उनको बाहर निकालने में बड़ी दिक्कत है। We face this almost every day, and to the extent that people start to challenge all these science behind this. See, the thing is, salt sugar ना बच्चा कभी भी खा लेगा, है ना। अभी फर्स्ट ईयर में किडनी जो है डेवलप हो रही है, Now developing kidney अभी fully functional नहीं है, so it cannot take the load of salt which is coming in, and therefore when you give extra salt, so it can lead to dehydration and passage of extra urine as well at the same time.
Okay.
Right. Similarly, sugar stuff, nature ने जो food बनाया है, they are naturally salty as well as sweet. So natural sugars are fine. Added sugar is generally not required at all, including juices and all. So ये first year में avoid करना है. Why? Because we want kids to taste all sorts of flavors and textures and fruits and everything. Because once they get the knack of salt and sugar and spices, which are pungent tastes, जो strong flavors हैं, तो वो बाकी bland flavors नहीं accept करेंगे. Right? So हम चाहते हैं ऐसी मिल्क जो है वो ब्लैंड है, बच्चे को उसकी आदत है, हमें लगता है कि वो बिना नमक बिना चीनी के कैसे खाएगा, हम तो खा ही नहीं सकते. But no, बच्चे they can easily take such foods to begin with, and it's always a good idea to gradually introduce, and that time happens after, it's generally recommended कि 1 साल के बाद salt and sugar introduce किया जाए, और वो भी बहुत slowly. सारी लाइफ खाना है, कोई जल्दी नहीं है, go very slow.
Okay, so let's be supportive in that case, and let's stop challenging them, and let's allow them to wean off this thing, and so salt and sugar दोनों avoid करने के लिए उनको allow करें, because mothers को हम generally push करते हैं कि हमने तो खाया था, why don't you give, especially the dadis and nannies. So it's a request that उन्हें पूरी जिंदगी खाना है, you can give a breather for a year at least. So डॉक्टर, बेबी का क्राई जो है वो बहुत चैलेंजिंग होता है न्यू मदर के लिए, एंड देयर कैन बी वेरियस रीजंस जिनकी वजह से कि बच्चे रोते हैं. कैसे आइडेंटिफाई करें क्यों रो रहा है? बिकॉज जनरली हम क्या करते हैं, हम हींग लगाते हैं, हम सोचते हैं कॉलिक की हो सकता है. सो बहुत सारे मिसकंसेप्शंस हैं, तो आप क्या कहना चाहेंगे इसके बारे में?
Yeah, I mean, see, newborn cry is actually a unique thing. जिस पिच पे न्यूबॉर्न बच्चा क्राई कर सकता है, हम पूरी लाइफ नहीं कर सकते उस पिच पे. सो नेचर ने एक यूनिक वे ऑफ कम्युनिकेशन दिया है न्यूबॉर्न बेबी को, जो कि बहुत ज़रूरी है. राइट, दिस इज हाउ दे कम्युनिकेट, एंड एक्चुअली अ गुड हाई पिच्ड क्राई इज अ हेल्दी क्राई. इट एक्चुअली इंडिकेट्स कि बच्चा हेल्दी है. ओनली अ हेल्दी बच्चा कैन क्राई लाइक दिस. Right, a sick child cannot cry like this. So it's reassuring that आपका बच्चा healthy है. Now what to do? So for new mothers, by default, every cry is a hunger cry. आपको ज़्यादा नहीं सोचना, आपको बेबी को फीड कराना है जब भी बच्चा रहे, irrespective कि आपने आधा घंटा पहले कराया, 1 घंटा पहले कराया, doesn't matter. Whenever baby cries, newborn baby, or for that matter first couple of months baby, just pick up the baby and start to feed. That's one. Now you have fed the child, baby is still crying, then look into the diaper. If the baby is wet, if the baby is soiled, the baby will again always cry. So clean the baby, dry the baby. Third, overclothing, especially in this weather, winter weather. Winter comes and kids suffer a lot because of heat. Why? Because we tend to overclothe. Right? So keep the room warm and comfortable rather than putting on too many layers. Because overstuffiness, overclothing also makes babies cry a lot. Right? Then another thing is mosquito bite, a very painful cry. So see, these are the common causes of cry. You can rule them out one by one, and then you will figure out what is the reason. Third, as you mentioned, we apply hing. Right, so hing application is actually scientific. It's a good thing. Not all the things in our culture are bad. This is actually one of the good things. Even we prescribe hing for around the belly button because it releases the gas. So colic होता है बच्चों को, which is, although उसका cause किसी को नहीं मालूम, but generally it's considered a growing normal pain, which generally goes away by 3 months of age. So उस समय बच्चा जब शाम को रोए unconsolably, even after feeding, पाँव मोड़ के, and then by the time day happens, it corrects on its own. So that means you're dealing with colic, in which case you can apply, as you mentioned, hing, you can just swaddle the baby, right? So all these maneuvers help with the colic situation. As you will grow into your parenthood, mothers especially, the new mothers, you will get to realize the kind of cry it is, right? So if it's a hunger cry, if it's sleep cry, babies, those who are about to sleep, they also cry. if it's associated with urine or stool, if baby is angry, if baby is frustrated, they are all different kind of cries, which eventually you will learn through your gut feeling. So don't worry about that, and just keep these 4 or 5 reasons in mind and rule them out one by one.
Wonderful. So now you have the key to follow. This is what you can do. First step is definitely, irrespective of the reason, you just feed the baby, and I'm sure the things would be sorted most of the times. If it doesn't, then you can look for diapers, and as the doctor has rightly said, there can be mosquito bite as well, and you can look for other signs. So I'm sure you must have got some guidance now, and it will give you some peace at heart. And let's go on to the next question, which even I want to understand. So क्या डाइट दें हम अपने बच्चों को, बिकॉज हम जनरली सुनते हैं प्रोटीन्स खाने चाहिए, वेजिटेबल्स खाने चाहिए, एंड कितना फ्रीक्वेंटली खाना चाहिए, क्या खाना चाहिए, बिकॉज हम देते तो बहुत कुछ है पर बच्चे रिसेप्टिव मोड में नहीं होते, तो वी आर ऑल लॉस्ट कि हम क्या सही कर रहे हैं और क्या गलत कर रहे हैं. सो व्हाट इज द राइट वे?
Yeah, so there's no end to this discussion. It's a Pandora box, right? So I'll try to shorten it and give you a summary of it. So first 6 months, no question, mother feed, right? So don't even think left and right. It's actually baby's right to have mother feed, right? You are shaping the baby's rest of the life by feeding the baby for first couple of years on mother milk, right? The whole immunity which you have acquired throughout your life, the mother अपने मिल्क के थ्रू बच्चे में ट्रांसफर करती है. So there is no comparison, there is no such food or feed available in the world which can do this. No matter how much technology advanced, no matter how much good quality milk which are available these days, but there is no match to mother's milk, right? Every mother produces a unique milk for that baby, which keeps on changing based on baby's age, baby's sickness, everything. It's a dynamic thing. It's a unique fluid which is there. So इसके बारे में भी हम आज तक चर्चा कर सकते हैं, बट अभी फिलहाल इतना लॉन्ग स्टोरी शॉर्ट कि मदर फीड फॉर फर्स्ट 6 months and then start some semi-solids after that, because intestines are now ready to receive some texturous feed also, right? So generally home cooked food which is boiled and mashed से start कर सकते हैं. So suppose सूजी का खीर, राइस का खीर, mashed banana, mashed boiled potato, all these things, soups you can introduce. You can find all these gamut of options online, but what they don't tell you is go very slow on it, right? Options are there and you can experiment with based on the kind of culture you come from. But as I mentioned before also, अब सारी जिंदगी फूड में बितानी है ना? तो फूड में धीरे धीरे जाना है. आपका एक टारगेट होना चाहिए कि बच्चे को मजा आना चाहिए. बेबी शुड एंजॉय ईटिंग. यू शुड नॉट बी फोकस्ड ऑन कि मैंने आधी कटोरी बना ली और ये फिनिश करनी है जैसे भी कर. नाउ दिस इज अ वेरी कॉमन थिंग्स पेरेंट डू एंड दे स्ट्रेस अराउंड फूड सो मच दैट ऑल द जॉय ऑफ ईटिंग गोज आउट, राइट? किड्स आर हेल्ड इन द लैब, फोर्स्ड टू ईट, and then these are the ones who become fussy eaters later on. So this is our OPD practice on a daily basis. All the fussy eaters are the ones in which parents are paranoid about food, whereas those parents who are totally chilled out, whether खाया खाया नहीं खाया, उनके बच्चे पीछे पढ़ के अपने आप मांगते हैं, right? So please be relaxed about food. Once the baby is 1 year old or so, they will be after your life if you don't give food. Don't worry about that, right? So that's one important point to note. Let the baby enjoy food and then they will become good food eaters. And they have to be seasonal. Don't get exotic fruits which are non-seasonal, okay? हमारी intestine की designing या हमारी for that matter genetic makeup की designing हमारी local food से हुई है. हमें बाहर just because now we have become smart, we can get stuff from South America, from New Zealand, doesn't mean it's good for us, right? Dragon fruits खा रहे हैं लोग. So all these things to be avoided. Just start off with very basic food and let the child enjoy. That's second point. Third, always give water also when you are finishing the food little bit. That also now needs to be introduced. So that's about infants. Now, toddlers, again, they should be trained to eat when the family is eating. So I'll not give you the options of food. There should not be any option. Whatever you are eating, now kids should be eating that. You can add extra ghee, extra proteins into it. That's absolutely fine. Junk food, I'm not even talking. We can have another session on that. But junk food is anything which has got a packet on it, we should avoid it. Anything, if you want to cook biscuits, you should cook it at home. Don't give it from a packet. You'll use the best oil, you'll use the best sugars, so avoid from outside. So, long story short, keep things very simple. Listen to the grandma on this. They are mostly right in these regards at least. So, and also give regular water. These days we get a lot of kids with constipation because they're not drinking any water. So, I think I'll stop at that. But any questions, we can take it later
in the
on.
end. Yeah, certainly. So just to remind you again, we will be taking up questions in the end of the session, and please keep adding on to your questions in the comment section, and also keep tapping the heart button so that we can understand that you are there with us and you are enjoying the show. So doctor, vaccination बहुत important है. और आजकल और न्यू वैक्सीनेशंस ऐड हो गए हैं, सो इट गिव्स अस अ कंफ्यूजन, क्या ये एक्चुअली लेने चाहिए या नहीं लेने चाहिए? आई मीन अगेन, व्हाट आर द मिसकंसेप्शंस रिलेटेड टू इट?
Okay, so vaccines again, they are lifesavers first of all. So I'll just give you a brief what vaccines are. They are not medicines. They are like we are giving an infection to your child, बट विदाउट कॉजिंग एनी सिम्टम्स. उसका कोई अफेक्ट नहीं होगा बच्चे पे, बट हमारी इम्यूनिटी को पता चलेगा कि कोई इन्फेक्शन आया है, एंड देयरफॉर इट विल माउंट अ रिस्पॉन्स टू प्रोटेक्ट यू विदाउट इवन प्रोड्यूसिंग एनी सिम्टम्स, सो दैट व्हेन एक्चुअल इन्फेक्शन कम्स, नाउ योर बॉडी इज ऑलरेडी प्रिपेयर्ड टू हैंडल इट. ओके, दैट्स ऑल वी आर डूइंग व्हेन वी आर वैक्सीनेटिंग. Now, जो हम वैक्सीन इनोकुलेट करते हैं, it can be either a dead virus or a bacteria or a part of that virus or bacteria. So sometimes during the manufacturing process, or because of the way vaccine is, there can be very mild symptoms of that particular disease, but they are extremely mild and rare, right? So vaccine का effect is way more, like 1,000 times or even millions of times more than the side effects. But again, because we give to millions and millions of doses of vaccines to kids, there are bound to be some side effects in some kids, just like any other drug, right? Even if I give paracetamol to millions of people, we will have some liver failure cases. So it's like that. That's how medicine works. So vaccines have been lifesavers, as I said. When I was doing my post-graduation and all, we used to have wards full of cases of diphtheria and all. But now with all these vaccines, thanks to them, almost all cases have vanished. So kids only come, they get vaccinated and go home. So the diseases have really decreased. So don't consider this as an expense, please. It's an investment for you. Okay, it's not at all an expense. Please make sure you follow all the vaccine schedules and get them timely done.
Thank you so much, doctor. So now we know that vaccinations बहुत सारी नई भी add on हो गई हैं, but that is for your good only. So don't avoid them, and even the adult vaccination for that matter are there. So you should get vaccinated. So doctor, कितना सोना normal है? बच्चों को generally हमने देखा है sleep is a deterrent for them. उनको नहीं सोना है. So I mean, what do you have to say about it? कितना with age for toddlers, for teenagers, कितना सोना appropriate है?
Yeah, I mean, so sleep is very important. Sleep is the time when actually kids grow. So if you disturb their sleep, their growth is disturbed. So a newborn sleeps up to 20 hours also in first couple of weeks out of 24 hours. So and it's very essential because otherwise they'll get overstimulated. Then infants, as they keep on growing, the newborns, then their sleep reduces to, let's say, 16 hours, 12 to 16 hours. Toddlers up to 14 hours, school-going kids, they require 10 to 12 hours of sleep, and then teenagers, they need at least 8 to 10 hours of sleep. And as I said, sleep is very, very essential. Whatever you have done throughout the day to assimilate that, to throw it out, the brain is designed like that to carry out all this function, and that happens during the sleep time. So it's very important to create a what is called a sleep hygiene around the sleep to be able to allow kids to sleep better. सो बच्चों को स्क्रीन नहीं दिखाना, टीवी बिफोर स्लीप नहीं होना चाहिए, लाइट्स ऑफ होनी चाहिए, साउंड का ध्यान रखना है. ऑल दीज आर द वंस विच डिस्टर्ब योर स्लीप. तो इन चीज़ों का ध्यान रखेंगे. एंड एज आई मेंशन द ड्यूरेशंस, इफ दैट इज़ फॉलोड देन जनरली किड्स आर हेल्दी. They don't even fall ill because their immunity is also at its peak.
वंडरफुल इन्फॉर्मेशन. सो नाउ यू नो, अगर बच्चा नहीं सो रहा है तो हो सकता है आप उसको वैसा एनवायरनमेंट नहीं दे रहे हैं, तो टर्न ऑफ द लाइट्स, साउंड को कम रखें. एंड डेफिनेटली स्क्रीन उस टाइम पे स्क्रीन टाइम नहीं होना चाहिए सोने से पहले. दैट ऑल्सो स्टिमुलेट्स और नींद दूर हो जाती है. सो स्लीप इज़ वेरी इंपॉर्टेंट. आपकी इम्यूनिटी भी इससे बिल्डअप होती है, एज डॉक्टर हैज़ राइटली suggested. So you please take care that the child is taking a sound sleep, and even the teenagers are getting the ample amount of sleep, ताकि वो कोई भी इन्फेक्शंस हो उनसे लड़ने के लिए उनकी बॉडी में इम्यूनिटी बिल्डअप हो सके. सो डॉक्टर, डेवलपमेंटल डिलेज को कैसे आइडेंटिफाई करें? कैसे पता चले कि ये लैंडमार्क क्रॉस कर दिया है एंड नाउ वी शुड कंसल्ट द डॉक्टर, एंड व्हाट आर द साइंस एंड सिम्टम्स?
Yeah, right. I mean, these days developmental delays are becoming a little common thanks to the screen which people are watching, and that's leading to hyperactivities and other developmental issues with the kids. Now, but in the infancy, as parents, you need to remember certain landmarks. There are too many milestones which kids achieve as they grow, but आपको कुछ ध्यान रखने हैं, जैसे कि head holding, right? So head holding generally 3 महीने तक बच्चों में आ जाता है if they are born at full term. But अगर वो 5 महीने पे नहीं आ रहा, then it's a red flag. Similarly, बच्चे का बैठना is generally at around 5.5-6 months. But if it is not happening by 8 months also, it's a red flag. You should be a little worried. You should consult your pediatrician at that time. Then again, then they start to stand with support at around 9 months. If it's not happening by 1 year, that's another red flag. Walking can vary actually. It varies till 15 months also. Some kids don't walk, but after that, if it's still not there, then again red flag. So see, just remember certain milestones, and if the kid is able to achieve them, that's good enough. If not, then you should just at least take an appointment and consult with your pediatrician.
And what about talking, doctor?
Speech also, yeah, similarly. So girls generally tend to speak little early, so their vocal skills are earlier compared to motor skills. The other is opposite is true for boys. So we give that much of a leverage to boys that if they don't speak any single true meaning word by 14-15 months, it's fine. But beyond that, it's not. Whereas in girls, 12 to 13 months is the upper limit. After that, they should speak at least 1 or 2 true meaning words. So if speech is delayed, one common thing to be ruled out is hearing. Because अगर बच्चों को सुनाई नहीं दे रहा तो definitely speech delay हो जाता है. And in India, hearing loss is becoming more and more common these days, to the extent that all good hospitals nowadays are doing regular hearing screen as part of their birthing things. So if it is not happening, the vocabulary is not coming, might as well rule out कि hearing तो ठीक है कि नहीं है, which is a simple test that can be done.
Okay, so now you know what are the landmarks that you have to notice. और अगर वो क्रॉस हो जाता है या वो डिले हो जाता है, then definitely you can consult your pediatrician and they can guide you better. डॉक्टर, फीवर्स बहुत कॉमन होते हैं बच्चों में, तो कब हमें उसके लिए वरी करना चाहिए या कब डॉक्टर के पास जाना चाहिए, कब हम उसको घर में ही ठीक कर सकते हैं?
Yeah, see, fever is probably the commonest problem which makes parents consult their doctors. और fever mostly viral fever रहते हैं because kids keep on going to the schools, they acquire it from their friends, from the community, and generally ये खुद ठीक होने वाले हैं, मतलब 4-5 दिन में अपने आप subside हो जाते हैं. Maximum sometimes you have to go give antipyretics which are fever medicines, but sometimes they may be a manifestation of underlying कुछ और प्रॉब्लम का भी फीचर हो सकता है कि फीवर हो, जैसे निमोनिया बन रहा है बच्चे को, या टाइफॉइड फीवर हो रहा है, या कोई ब्रेन में इशू है, या पेट का इशू है. सो ऑल दीज will have certain specific symptoms as well, which as parents you need to watch for. So suppose कुछ सारा sputum बन रहा है, बच्चा fever जा ही नहीं रहा, रुक ही नहीं रहा. So in viral fever what happens is fever goes high. When you give fever medicine it will come down. Kids are absolutely fine in between, playful, but once fever comes back again they feel bad. So this cycle continues for 4-5 days and then it recovers. That's the general natural course of a viral fever. Whereas when it's associated with some other problem, then fever can be very, very high. And it will not respond to fever medicines also sometimes, right? Depending on कि कौन सा infection है. So accordingly you have to, so अगर पेट में infection है तो vomitings तो नहीं है, loose motions तो नहीं हो रहे, chest का है तो cough cold sputum के साथ तो नहीं आ रहा है, and all that. So keep looking for other symptoms as well. To make diagnosis of something else going on and then visit your pediatrician.
थैंक यू सो मच डॉक्टर. सर एक तो हो गई फिजिकल सिम्टम्स एंड साइंस की बात, फिजिकल प्रॉब्लम्स की बात. दूसरी है बिहेवियरल कंसर्न्स. कई बारी बिहेवियरल टैंट्रम्स और कंसर्न्स बहुत ज़्यादा बढ़ जाते हैं. सो वो कब हमें आइडेंटिफाई करना चाहिए कि अब प्रोफेशनल हेल्प की ज़रूरत है, ये नॉर्मल नहीं है, एंड क्या ऐसी एडवाइस है जो आप देंगे या क्या बताना चाहेंगे आपकी कि इस चीज़ में अब आपको नॉर्मल नहीं लेना चाहिए?
Yeah, I mean, as we discussed before also, right, behavioral issues are on the rise. I mean, post-COVID, especially because of the increase in screen time and now addiction to screen, the behavioral issues are really going up. So some temper tantrums are expected and are absolutely normal also in kids. We don't expect parents to totally understand the kids and therefore they would throw out certain tantrums, but as long as they are occasional and they correct on their own, it's absolutely fine. I mean, इसमें कोई problem नहीं है. Every child goes through all these things. However, it can be a matter of concern when it's prolonged and persistent. It's associated with damage to other kids. So for example, you hear complaints from the school teachers about related to these temper tantrums, that something serious has happened because of that on a regular basis. So these are the red flags you should be considered about. Screen time is really causing kids to become hyperactive and not be able to focus on anything, and therefore that kind of frustration leads to all these temper tantrum these days. Might as well consult. Of course, try your best how so much you can reduce the screen time, and if it is still persistent, better to take professional help.
वंडरफुल. सो ये क्वेश्चन हमारे बच्चों की तरफ से, कितना स्क्रीन टाइम अलाउ करना चाहिए? आई मीन क्या एटलीस्ट अब, बिकॉज गैजेट से हम दूर नहीं रख सकते, होमवर्क्स भी हैं और टेक्नोलॉजी इतनी एडवांस हो गई है कि एक्चुअली इसका रिक्वायरमेंट है. सो कितना ओके है और किस एज से हम उनको स्क्रीन इंट्रोड्यूस कर सकते हैं?
Yeah, unfortunately we live in this kind of world where we cannot, I mean, it'll be I'll be fooling myself if I say just don't do it. It's just not possible. But we have to keep it within the realms of using it judiciously. It should not harm us, right? That's for sure. So our brain, बच्चों का जो brain बनता है वो पूरी life adult size बन जाता है by the time 2.5, 3 years maximum. So it is recommended that first 2 years में तो screen नहीं दिखाना बिल्कुल भी, right? Because our brain is designed, wired to see the natural life the way it is, whereas the screen shows it totally the opposite, right? It's there before the screen is being processed. There's another screen. Before that is processed, there's third, fourth, fifth, sixth. So brain totally gets confused, and then its wiring gets affected. And secondly, brain is designed for a two-way communication. When I'm talking to you, I'm getting a response, and then I'm responding to that response. That's how brain is designed. Whereas when I'm watching the screen, it's a one-way communication, right? It's not at all a communication, in fact. So again, brain growth gets affected. So first 2 years, strictly no matter how much you would want to, except of course, sometimes when you're doing video calls and all with the parents, grandparents, that much is fine. but otherwise no showing any kind of screen. And when I say screen, it includes television, laptop, mobile, absolutely not. All right, 2 years onwards, 2 to 5 years, let's say 5 till 5 years, around 1 hour of screen time is okay, but then that screen time should be supervised. The television or the screen should be on and when the parents are also there, so it should not be unsupervised, right? And try to use the screen where there are no advertisements. Okay, 5 year onwards, again, there's no such limit, but up to 2 hours is okay, but it should be supervised if possible. So, long story short, keep it to the bare minimum, use it when it's really required, use it for constructive means rather than consumption means, right? It should be productive and constructive rather than you should not be consuming the media, so especially social media. But as long as it's creativity, it's enhancing your creativity, it can be used.
Thank you so much, Doctor. So before I ask my last question, I would request all the viewers to please flood the comment section with all your questions. We'll be just asking the question, taking the questions after my last question. So Doctor, before I wrap up, I want to understand about the concept of 1,000 days of nutrition and the thing that you're working on. I really want the viewers to understand and know about that novel thing that you are planning and trying to introduce.
Yeah, so we are working on a platform that will bring modern medicine, the evidence-based modern medicine, and the ancient wisdom of Ayurveda. I think being in the practice for almost 2 decades now, I find that we can utilize ancient wisdom as well. We tend to work in silos. So modern medicine works its own ways. The Ayurveda also works its own ways. Whereas I find there are benefits of both, right? So it's just I'm trying to utilize my training and whatever training I've done in Ayurveda as well to bring them together for the benefit of the babies, because I think especially pediatric practice is more of a counseling practice and it's very much related to diet and all. So diet is a big component in Ayurveda. So we are trying to bring these two specialities together, and especially the first 1,000 days of life, which I believe, and not just me, now the UNICEF and other bodies and all over the world are looking into it, delving deep into it, that first 1,000 days are the ones which shape the rest of the life. So the pregnancy, 270 days, 365 days of first year, 365 days of second year. These are the first 1,000 days, and they will shape the rest of the life. What kind of diseases you will develop, if you get a cancer or not, you'll get mental disorders or not, how long you will live, everything more or less tends to get logged in these 1,000 days. So that's the importance of this period. So we're just trying to kind of make sure that this window of opportunity is utilized to its best.
That's wonderful. So first 1,000 days of life are very, very important. They are going to structure your life ahead, and how healthy you are, how well you are able to perceive the environment and react in accordance, all depends on those first 1,000 days, starting from the conception, the entire pregnancy period, first year and the second year. So that's a wonderful thing, and I'm sure we all will be benefited by that platform. So let's take on to the questions. So Doctor, the first question is, do you recommend formula food for toddlers? What do you have to say? If no, what are the best home cooked foods?
Yeah, okay. So, everything has to be home cooked if possible. If you're traveling, then it's fine. You can take sometimes the pre-cooked meals, but as long as you're at home, you would not eat a pizza or anything on a daily basis, right? So why would you give anything packed to your child? So as I mentioned, it should be a cooked meal, and the way you eat, it should be exactly the way that it is. So you would have a breakfast, you have a lunch, a dinner, and in between 2 snacks. So 3 major meals, 2 minor meals, and it should include all colors of fruits and vegetables. I'll not give you the recipes or the thing because it's very cultural, but as long as they are home cooked, as long as they are eating what is called as a family pot, which means you are not giving them the food first and then you are eating, but all of you are eating together, that's what you should strive for, right? So it should include a balance of vegetable, fruits, carbs, um, so roti, sabzi, dal, chawal, South Indian stuff, idlis and upmas. If you're non-vegetarian, you can have an egg. So 5 eggs a week is what is recommended in toddler age group. So all these things you can mix and match and keep on changing the menu. This is important because kids, they don't like to stick to one particular menu. So you have to keep changing the variety of food.
So processed food definitely you should avoid. Doctor, if the hearing of the child is all okay, but speech is still not clear by the age of 3 years, is it something to worry about, and what can we do to resolve it?
Yeah, so 3 years, so we need to understand how much delay is there. So when you say delay, what is meant by delay? So how many words, true words, child is speaking? Generally, initially, what we recommend to the parents is to maintain a speech diary. So for 3 months, each month, just write down the number of words a child is speaking. Then on the next month, again write down third month. See how many words are added in each month of that diary, right? If there is no addition and the total number is less, it's definitely a red flag. You have to visit a specialist. If the number of words are increasing, because some kids are late bloomers, so that needs to be checked, because you don't need to jump on to the specialist immediately just because of a concern. So try to maintain a speech diary for 3 months, see how many words the child is speaking. If they are on the rise, then child might improve on its own. If it's not, then you should consult. But at the same time, please, if your child is having excessive screen time, you should reduce that.
So please maintain a diary, speech diary, so that you can understand the pattern. And if it is positive, you don't have to worry. But if still there is a concern, first of all, reduce the screen time, and then you can consult your doctor. So, doctor, one last question from my daughter's side. How many times can she have Maggie in a week?
Yeah, we are all nostalgic about Maggie, right? So, yeah, only for you, Divya, maybe once a week. But again, it's a packed food. So, I know it's more for you than for your daughter. And you must have started for her.
No, she's already given a question here. So.
Oh, is it? Okay. Yeah, I mean, when she does something good, it can be as a reward. No problem.
Okay, so I'm sure you all have got your questions ready, and there are a lot of other questions also. We'll definitely, from the chat box, definitely we will take these questions and reply to you. But right now we'll have to end this talk here, and thank you so much for all the love and affection that you've showered, and thank you so much, Doctor, for joining us today. And it was a wonderful, informative session. And I'm sure we will again connect for lots of other questions that they're still pending. And Namaskar, this is Dr. Divya Agarwal, and we were on Bright Talks by Pacholi Aesthetics and Wellness, an educational initiative by Dr. Preeti Seth. And stay connected for our next episode on 19th of December. Thank you so much.